Hi, I am Prakash. This is PharmaGuard, a PharmaGuard, a resilient antibiotic stewardship agent built for the TrueFoundry Resilient Agent Hackathon. Clinical AI agents crashes when models fails, tools go down, or the patient data leaks into the prompts. PharmaGuard keeps working through all of it. For example, if the pharmacist gives the general clinical case query, if the pharmacist queries with amoxicillin for elderly patients with renal improvements. That's why the creatinine is 45. This is the normal path. I just give the normal path. Now I give run PharmaGuard agent. You just look the logs. Guardrail checks first. That is a load filter, and then it may go for MCP. It may go for MCP gateway that calls OpenFDA, and give that full statement and go for AI gateway, that is TrueFoundry AI Gateway, to the AWS Bedrock Nova Micro. Right shade, it may use that whole recommendation. Which drug should be taken, which drug it to be taken with what dose for that patient. Everything it may use. Okay. Now I will give that second scenario, that is model failure. For model failure, we have to simulate that same query with that simulate primary model failure, that is gateway fallback. Now I run the PharmaGuard agent. You see the local pre-check is fast, but forwarding to TrueFoundry guardrails, that OpenFDA is to be error because the MCP model didn't allow it. Then it go for TrueFoundry virtual model priority routing hub. Immediately activates the llama force count as fallback. State is preserved. The clinician still get the answer. The agent did not crash. Okay. Now we go for next. That is tool failure. Tool failure mode on with that same query. Now I run that PharmaGuard agent. Now you see that the local free filter passed directly forwarded to this tool for the guard kills, and that OpenFDA amongst the two failure estimators, the OpenFDA is unknowable. Therefore the virtual model routing happens. This may use that config and the agent is complete. The primary didn't crashes and gives that data, gives that clinical recommendation data. Now this is the last one. You see how it may works. Now in case I give that patient data like patient SSN 1 2 3 4 5 6 7 8 need for amoxicillin. Now I give that run PharmaGuard. You see it may block because the patient data is there. It means that the TrueFoundry guardrails interrupt before any model or tool is called. Request is blocked because PAA is never reaches this LLM. The PAA redact pharma guardrail in pharma safety guidelines groups. This is how it may works. In case I will add on it. Now I will give the different query. Best antibiotic for pneumonia in penicillin allergy patient. Now I run without anything I selected, just I run it. You see the same resilient pipeline is going on, the guardrail checks and then OpenFDA tool and the virtual model routing by AI gateway because of this AWS Bedrock Nova, and that give the different answer for the patient. For example, it may give the drug azithromycin for it. This is how it may work, as well as the MCP is the tool gate, as the NCP is the tool gate, and the GitHub and also I give that GitHub should be given and built for TrueFoundry Resilient Agent Hackathon 2026.